Wanted to say is we've never before met on a Monday. We've never had a student who got into medical school come back and present in his or her medical school persona and so on. Yeah, so that's what we've got today. And so Taryn, take it away. Yeah.
Okay. Hi. Can everybody remind me of their names?
Yeah.
I'm Sarjana.
Okay.
I'm Hannah.
Okay.
And I'm Isla.
Okay. I've met you two before, but my names are not my forte.
It's okay.
Yeah. So I'm going to be talking about human flourishing and collaborative intelligence. This is basically the same presentation that I gave to like the last class, but I'll talk about some of my, like how my perspective has changed a little bit now that I'm a lot deeper in medical training and kind of understanding things from that medical perspective. First, I'd like to acknowledge that we are on Treaty 6 territory. It's such a privilege to be able to learn and grow with everyone in our diverse community, and that we should really honor those traditions in how we learn and think about how we can use these great resources well. I've been really pleased with how, like, we're in Calgary, we're Treaty 7 territory, so that's where I go to U Calgary now. And I've really been impressed by how at the start of each lecture, the lecturers have like a treaty statement, but they always come with like a really nice story, and it seems really genuine. And like at the very first like week of classes, we had a lot of like Indigenous folks involved, and like a lot of I don't know, like celebrations, and they fed us like dinner and had us like, you know, talk with everybody and kind of share our stories. And I really have loved seeing that be implemented so beautifully, and to really appreciate like the Indigenous perspective of like storytelling and sharing and getting to know people on this like really deep personal level. So I'm hoping to keep learning that, and I really would love to encourage you to do the same. So as I said, I am now a first year medical student. I have the backpack. We are brat girlies. But in my past life, I was a microbiologist. I have a master's in laboratory medicine and pathology. And in my undergrad, I did like a major in biology and a minor in women and gender studies. So I have a background in like critical theory, feminist philosophy. I've done some like international humanitarian projects, and I've been involved in like adaptive leadership stuff as well. I've found like my jaunt as a microbiologist was very fun, but very like hard sciencey. Do you know what I mean? Like it's, you look at a slide, you look at a plate, it is what it is. So it's been really exciting to kind of get back to more of the like social sort of issues and bringing things together more as we're learning, talking more about like critical theory. And I'm sure everyone in my tutorial groups, like we meet once a week or twice a week to kind of go over cases, and I'm sure they're so annoyed at me because I'm like, actually, what if they can't afford it? But it's been really cool to kind of get back in touch with that. So my topics in this course usually revolve around human flourishing. We can think of the human experience as this sort of continuum between like pathology, when things are going really wrong, and then on the other end there's flourishing. which is like living in this optimum range of human functioning. And of course, there's kind of this middle ground, which I think a lot of folks find themselves in you know, different areas of their lives. And I think historically, when we think about Western medicine, we think of it as, when we think of like flourishing and living in this like optimum state, we think about very like measurable parameters, right? We think about their blood pressure and their BMI and how much fiber do you have. And I think that there's this really exciting shift now to kind of expand on that and to think about the ways that it's really about the person's like subjective experience, and that, you know, I when I took like a bioethics course a few years ago, they defined autonomy as like living your own best life. And I think that that is really, I think that that's really the goal of medicine and all these like medical adjacent fields. But we'll get into that more. I think that, so this is a TED Talk that I really like. I'll let you watch it on your own. But I think historically AI has been used to kind of help with these very these very objective, quantitative aspects of health. So this doctor talks about how AI has been trained to look at these like retinal images, and that, you know, by analyzing millions of different retinal scans, it's able to detect abnormalities that experts would usually miss, and kind of tell you things that you would have never imagined possible. And that's incredible, right? He also talks about how, you know, using AI in practice can lead towards or allow doctors to have keyboard liberation. So often doctors are forced to just write notes and document every single aspect of the encounter, and it often, I mean, nobody wants a doctor who's not even making eye contact with them because they're just typing as fast as humanly possible, right? And so he suggests that perhaps artificial intelligence will be able to be used to kind of like record those interactions and then make notes based on what the patient and the physician actually talk about, so that they can have a more meaningful, engaged conversation. Yeah, so we're, sorry, I should have given you more of the structure, but we're orienting towards like how AI can help kind of these like objective things, and then we'll talk about whether and how it can do maybe the subjective things. So these are my examples of the objective stuff. Here's an example of, it's something called Clinical Key, which allows physicians and researchers to like look up empiric evidence for things. This chat bot will allow the physician to get like evidence-based responses, and I'm sure it also gives like, here's the paper that this recommendation is from, so that if the physician wants and they're confused about it. We just learned about the diabetes like management, and a lot of it is just, we use this medication because that's what the research says is best. We use this other medication for this thing because that's what's best. Like, it's very confusing. And so some of us have used like ChatGPT to try to help us understand maybe why XYZ paper is finding these things, and not just like memorize them. So this is a really exciting tool. So as I said, I call it my G-Boy. I call ChatGTP my G-Boy. And prior to med school, I knew it was a thing. I liked it in theory. I thought that it was this really cool idea. Maybe I had like asked it some silly questions about, why is my hair this color and blah. But I had never really thought about how I could use it for my studying. And now I use it every day. And most of my classmates use it every day as well. Obviously, all of our exams are online, and we don't really have like or they're not online, sorry, they're multiple choice. So we don't have access to like we can't cheat or something. We have to actually learn the content in order to do the exam. And we don't really have essays or anything. So it's not like we're using it to actually teach ourselves the content. So a lot of us use this Toronto Notes GPT. So Toronto Notes is kind of like the gold standard textbook in medical education, at least in Canada. And you can ask it anything, and it will tell you a pretty good answer. And you can ask it where that answer came from, and it will like tell you, I drew this from, I'm going to talk about diabetes because that's what my life has been, but like, this is from the Diabetes Canada guidelines. It suggests this and that. So it's really incredible. These are actual screenshots of things that I've asked it. I really like to use it to make like tables. I'm a very like visual learner, and I find that having it just spit out something super simple like this helps me really understand, how to compare different things that are super similar but totally different, and really help me understand like the underlying physiology, because if you just try to rote memorize everything, you're gonna forget it instantly. If you don't actually understand why this thing is happening, when they start asking you like about this really complicated disease that involves these systems, it's gonna make no sense. So having something that can break this down for me just literally instantly has been incredible. I also have enjoyed being able to like feed it my notes back. So we just had our exam this week. I have like this giant like 100-page document of all the notes that I've been taking for this unit, or at least I think I mentioned the cards, like all my cards notes, and I'll feed it to ChatGTP and say, okay, I want you to find all of the medications that I've listed in this document, so that when I'm going to study, I can just see these are all the medications, these are all the enzymes that we learned about, and then have it, I really like the little arrows, so I get it to break down, like, okay, this to this, up, down, and I find that has really, really helped. I know some folks in my class who are a bit more skeptical of this sort of technology, and they spend hours combing through like actual textbooks and looking online and looking through their notes to get really simple answers like this. So it helped me spend my time to do things that are a lot more important. Yeah, I think it can do a lot of really creative things. I had to memorize the glaucoma scale for our exam, which is just words. It's just like there's 3 categories, and each one has like 4 to 6 subcategories that you score things on. And one of those categories is like how someone, their motor response to something. And so I wanted to remember those are like the letters that I needed to remember for like the different levels. And so I got it to make me a mnemonic that related to motors. So I would actually remember that this is the motor one. So there you go. New engine firing will limit consumption for your glaucoma scale. But yeah, I think that it's really, really fun and helps me feel a lot less behind on topics, because it recently dawned on me, and like they fooled us a little bit with the first exam. It was like deceptively easy. I think we all got like 95, and then they hit us with the second exam, and that's like the games have begun. Do you know what I mean? It has started. And so I think that now that we're kind of in the thick of it, having these things that just help make things as simple as possible, help us like digest these really complicated topics, is how we're all kind of staying afloat. Yeah, I've heard it likened to drinking from like a fire hose, and that's really how it feels these last few weeks, where they've ramped up the content and it's going in all sorts of directions that vaguely relate to each other, but yeah, having these kind of ways to simplify things and explain them to yourselves makes it a lot easier. Yeah, medical students also have to do something called an OSCE, which I had never heard about. It makes total sense that this is a thing that we have to do, but it never occurred to me that we would actually be tested on these things. That's on me though. So every week we learn different like practical skills, where you have to like go in and talk to like a pretend patient and get their history, because of course they're having a heart attack and they're coming to see you, so you have to figure out what's actually happening. And then other times you have to like perform a physical exam and listen to all the things. So there's AI tools that you can actually like practice with, that will pretend, like we get actors once a week who come in and say, oh, my chest hurts, and you pretend with them. But I think this one is free, and you can play around with it. You can change the difficulty. So like I think if you go up to hard, like they'll threaten to leave, or like they'll start yelling at you because you said something wrong. So yeah, it's really cool how how these tools are available, but also when you're in the thick of it and like desperate times go to desperate measures, but like not desperate measures, really creative and inventive measures. Yeah, it's really cool how these sorts of tools can be used. Yeah, I wanted to ask, like, is this news to you? Because this is new to me. Like, this was an exciting discovery. I'm the one in the tutorial group when nobody knows the answer. I'm like, I'll ask my G-boy. Like, and it'll tell me exactly why you don't use this medication for this thing. But yeah, I'm obviously a little bit more slow on the uptake of this sort of technology. I wanted to hear, like, is this something that you guys use in your studies? Do you have tips for me of ways that you play around with these sorts of things?
Well, I was just gonna say, I thought the mnemonic thing was like genius. I feel like that's something I can definitely see myself using personally. I think I'm kind of on the cusp of trying to get myself into using more resources like this in my studies. I feel like I also had like a period of like just skepticism when everything was kind of coming up, where I was kind of like, am I sure that this is gonna be like 100% accurate, or is it better just like going the way like people usually do with textbooks and stuff. But I can definitely see myself like the way that you're talking about how it saves so much time going through textbooks and stuff. I can definitely see myself using that for sure.
It really helps me because sometimes I think that I'll understand something. Like we watch our videos, we learn our stuff, we listen in class, and then sometimes my brain just like farts and I can't remember if this makes it go up or this makes it go down. And so I would literally just quickly ask, does this make it go up or does it make it go down? And then it just gives me a short, definitive answer and I move on. Like I don't have to go digging for these answers. And of course, I'm a curious person. I think that having a sort of natural curiosity and like, especially when it comes, like understanding the physiology is the most tedious thing that you have to do as a medical student, but it is how everything makes sense. It's how you feel like grounded in what you're doing. And so to be able to say like, does this do this? And it's like, yes, it does this. And I say, oh, well, what if this happens? And then it'll tell me exactly what if that happens. And I think that, I mean, it's really helped me keep that curiosity and like that quest for a little bit more and rounding out my knowledge that, I don't talk in class usually. I don't put my hand up when there's 200 people so I would be afraid to ask these questions in class. So to be able to just like ask my G-boy, like what is this thing? It's been super helpful.
I wanted to ask, have you ever had a moment where you asked like your G-boy something and then it like gave you an answer that you thought was like wrong or like you questioned it yet or?
I have had some where what I've been told in lecture or like the notes that I've been given don't quite match what the answer is that it gives me. And so what I'll do then is I'll look at usually for our class they'll tell us like this is the Diabetes Canada guidelines, this is whatever guidelines, like this is the reference that we want you to know. And then I'll get ChatGPT, I'll say, can you fact check this based on, and then I'll either upload the document to it or just say like Canada Diabetes, because that's easily searchable for it. And then it'll go line by line and say like, yes, this is accurate, yes, this is accurate. And then it'll like either correct itself or tell me, because sometimes my notes are wrong. Sometimes whomever wrote the notes, when you actually, because then if they disagree, then I go look myself and ChatGPT will point out like the updated version of what the guidelines are. But yeah, you have to kind of learn how to speak its language. You have to know how to ask it for exactly what you want. Like when I make these tables, like I'm bossy. I'm bossy with how I want it to make these tables. This one is just kind of made by itself. This isn't one that I had much say in, but I will tell it like, I want you to tell me the pathophysiology, and then I want you to tell me this, and then this, and like I'm very specific. And when it makes a table and I don't like it, I'll say break this down more or add this column, and then I'll eventually get to a point where it's what I wanted for it to make. So sometimes it takes a few iterations of me being like, not quite, try it again, do this differently. But I think when you kind of, when you develop a relationship with your G-boy, you can kind of learn how to ask it for what you want, and tailor it to, like I said, like me and the up down arrows, that's a love affair. Like my brain can't compute the word increase and decrease, apparently. It's too many letters. So I've learned to ask for it to just do it this way so that I can just really quickly see what the thing is. But I'm sure other people, you know, have different preferences that they could then kind of go down different avenues. But yeah, I'll sometimes ask it, like, if I'm confused about how to even, I don't know. We had this one topic, like hyper and hypernatremia, so like high salt, low salt in your blood. And what they give us for those questions is literally just like a bunch of blood work. And I've watched the video, they explained how to approach it, but realistically, it's a little intimidating to figure out how to approach it. So then I'll like ask my G-boy how to approach it. I actually have all my notes but I'll ask my G-boy how to like approach it, and then it'll tell me like, you should look at this thing first, and then you should look at this thing next, and then this and that. Like, I can kind of get it to help me. There are some that make flowcharts. I haven't found one that makes like a nice flowchart yet, but there are ones where they'll like walk you through this one. Like, it'll walk you through exactly how, like, okay, if you have this problem, look at this first, and then go here, and then do this, and like it'll tell you exactly which thing to look at first, which helps demystify and make it a lot less intimidating to just look at like these 8 lab values and no context. Yeah, so I've been having a lot of fun playing around with it. I've been trying to encourage my friends and like learning from how they have been playing around with it, but it definitely is a skill, and like the more that you can kind of play around with what you like and what it can do, the further you go. We also have like all of it's a flipped classroom, so most of our content is online, and they upload the transcripts for all of those videos. So I'd say like at least half of our class will upload the transcript to ChatGTP first before they watch the video, get it to summarize it, and then when you're watching the video, you can just kind of like bold the things in the text. Or as you can tell, I'm a very colorful kind of notes person, so I'll just like, okay, this is this color, this is that color, rather than, as I'm watching the video, have to type every single little thing down. Like, we all tried doing that, and like a 10-minute lecture would take like an hour because there's just so much content to cover. So yeah, that's the most common way that people use it, like the newbies to the G-boy, but us curious people have been making it really work for us. But yeah, how about y'all? Do you chat GTP?
Yeah, I wanted to add, I do use it, but I wanted to ask you, because sometimes when I use it, it's not always accurate. Like if you ask it, let's say a common question, like I know one that I've seen a lot of people talk about, is you'll ask it, how many letters are in this word? Mm-hmm. And it'll obviously tell you the wrong answer. And then you start to argue with it. You're like, no, it has this many. You're like, no, and it'll argue back and say, no, it has this many. So when it comes to a new concept in medicine, when you're studying something and then you're going back to ChatGPT and asking it these questions, how do you know that it's going to give you the accurate information, especially if the information is new to you?
I think that like there are these different ChatGPTs that are out there, right? So for us, we kind of treat like the Toronto Notes one as more of a gold standard than just the regular ChatGTP, because we know that like it's been trained on the textbook that is supposed to be the thing that we know. Yeah, I I have seen the thing you're talking about.
Mhm.
I don't know why that happens. I
Right.
don't know exactly how it works, but I think like you still have to utilize your notes, right? Like you still have to pay attention in class. It is just kind of this like supplemental thing that I'll use for clarification. Or the nice thing with medicine is that there are these guidelines that are very well documented that are the things that we're supposed to learn. So it's really convenient to be able to say, like, cross-reference this with like what the Heart and Stroke Foundation says, because what you're saying is a little suspicious. But I haven't, like, I think that's just a weird bug that it does with the words. Most of the things that it says, I don't really see issues with. Again, you're right, I am just learning, but the like pathways and the basic physiology that it suggests is usually fairly accurate in my experience. Like, we'll be having a roundtable discussion in our tutorial group, and I'll ask it to like answer the question that we're working on, and it'll bring up points that we're kind of missing, and I'll say them. And we always have like a preceptor, like an actual doctor who's kind of supervising our conversation, and they'll be like, oh yeah, that's right, like I forgot that that's a thing. So it's definitely something to be used like not passively. You have to kind of know when to interrogate it and when to say like, are you sure that that's right? Could you please reference a thing? Like, could you please it'll cite its sources, which is wild to me. It'll like pull up academic papers and say like, I got this from this, and then you read the thing and it actually did get that from that paper. But yeah, it's something that you have to be mindful of and like very actively engage with. You can't just like accept that what it says is the ultimate truth, because like you're saying, it does make mistakes sometimes.
So the AI that you use, is it like specific to medicine? Like, does it like specialize in medicine, or is it just like general that you use? Like, is it?
I mean, I usually, this is the one that I have bookmarked.
Right.
So this is usually where I start, but I do often, out of just laziness, I'll just use the regular like chat GTP for whatever the latest is.
Right.
But this is the one that most of us like consider to be, you know, the gold standard, or
Right.
King chat GTP. Yeah, but it really depends. Like, this works for us because we have these really strict guidelines, and it all has to be evidence-based, what we're learning. So it's easy to demand, okay, show me the evidence, use the updated guidelines, look at the Canadian, because sometimes it shows me like American guidelines, because yeehaw, you know, but you have to kind of specify, but it does a pretty good job at that. I could see for a university student, it might not, like, you're not expected to do the guidelines, right? Like, your course coordinators are kind of making their own curriculum and choosing the depth that you have to know. So I could see that being a little bit more challenging. Like, there is this kind of ultimate evidence-based truth, and hopefully these sorts of things can tell you, but sometimes in undergrad courses, they only want you to like focus on like the historical perspective of that thing, right? Or not go into that much detail that could kind of get you muddled down or confused on the exam. So I do think that compared to med school, there's a little bit more challenge in how I would use it as a university student.
Right.
Thinking about AI assistance as a general thing, there are people now predicting that humans will never be alone in the future, that you'll always be accompanied by this part of you that's an AI that helps you remember things and so on. Does it seem to you like there still is a value of solitude in some part of your life and like seeing what your own biological brain can do by itself every now and then, or not?
I mean, this is my own like biased perspective, but my brain is special. Like, my brain will forget things that I'm not sure that regular folks will forget. Like, I'll forget to get groceries, even though I know I need to eat, you know? And so, to me, even just like setting up a reminder on my phone, and I'll set it at 5 o'clock because I know that's the time I'll leave school. Go get groceries. Like, in a way, I'm not sure that that's like an AI sort of thing, right? But that is a way that we might integrate even just simple technology into our lives. And I've begun doing that with bigger things, with AI. AI planned my trip to Mexico. Like, I told it, I really like these sorts of things, and I really like those sorts of things. And I said, okay, tell me what is available in Cabo, and I will look into it. I think that it's a really exciting tool, but it doesn't feel like this other entity that's like telling you what to do, you know? Like, it is maybe becoming kind of an extension of ourselves, where we are the drivers and we're saying, I like these things, I want to do this, I need to do this at this time. And it's just kind of becoming this extension of your brain.
Right. Yeah, if you think about like when you're sleeping, do you take your phone and put it on a charger somewhere where you can't actually hear? Or like do you sleep with it in your pocket, right? And if it vibrates, you wake up. So maybe the future is more like that, a really intimate, relationship with this electronic AI thing helping us.
Yeah, but I think like any healthy relationship, there are boundaries, right? Like, I think at least in mature relationships there are boundaries, and I think the interesting part about like the relationship with AI that kind of differs from the relationship with other people is that we are the only like driving factor in that relationship. We get to be the one who says, here's my limit. I don't want to look at my phone after 9 p.m. I don't do that, but in a perfect world, I don't want to take my phone on this camping trip because I just want to be around nature. And I think that is probably going to look a little bit different for everyone. Like I said, what you're suggesting is like, do I need to see what my brain can do without AI, without technology? I know. I know what it's capable of.
Yeah.
And I don't need to.
And it seems to me the short-term and the long-term answer are obviously different. Like in the short term, maybe it is good to turn off the AI sometimes and so on. But because AI is going to evolve so much more quickly than we will, if you think 50 years from now, you're probably not going to turn it off because it is uniformly more capable than you are in every way. That's not really true yet, but it will be at some point.
Yeah, I think that it's going to be a very like individualized experience. You know, even all of us in this room, we know what this is. We all could make an account, but I think we all kind of have our own idea about the role that it might play for us, our own level of comfort with, like, there are people at school who like will not touch it. I don't know if they feel like it's cheating to ask it questions, because again, we're not using it for the exam or for any sort of like marked thing, but there are folks who just don't want to touch it, and that's totally fine, right? But I think that it will just be a very like individual driven thing, and I think knowing yourself really well and knowing, like, I know that I like my tables to look a certain way, or I know that I will never remember to go run errands when I need to. I think knowing those things about yourself, accepting those things about yourself can kind of help you decide the capacity and the nature that you engage with these things. Yeah, Hannah, do you still have a question?
I think I was just like wanting to like bounce off of what you guys were talking about.
Mhm.
Like, I see like how my sister uses ChatGPT and she's in high school,
Mm-hmm.
and how I think a lot of like people who maybe haven't had that much experience with ChatGPT think that whatever answer they give them is the answer that they'll take.
Mm-hmm.
But I think it takes a lot of filtering, and it takes a lot
Yeah.
of like when you kind of get used to it, you tell ChatGPT what you want to hear,
Yeah.
right? So you really need to go through a lot of filtering. Or like, for example, if I'm writing a research paper, I ask it for certain, I guess, sources,
Mhm.
but it won't give me exactly what I'm looking for. So I have to be very, very like detailed in what I'm looking for, what
Mhm.
I want it to tell me, because if it doesn't, then it's kind of useless for me in that moment.
Mhm.
And I was seeing how my sister was using it in her like in one of her assignments, and how it just gave her a big blob of information, and she kind of copy pasted it.
Mm.
And it's like, you know, not all of it is necessarily what you need. You need to filter through it, and like that'll ultimately give you what you're looking for.
Mhm.
But it's interesting to see how some people use it just for what it gives it, and like how some people really know how to use it and filter through it and get the information that is actually useful.
Mhm.
So yeah, just I wanted to bring that up.
Yeah, that definitely touches on what I was getting at with the like you have to be a very active participant. You have to be very purposeful in what you ask it, and also very mindful of what you're gonna do with that information. Like, especially in research, or you know, something where there are these really high standards and you're expected to, anything you cite has to be legit, right? If ChatGPT says, oh, this is in that paper, and then it's not, like, that's on your integrity, that's on you as a researcher. And I think that I like that you bring up high school, because I think there's going to have to be more education around how to do these things properly. Like, I went through university and my master's without really knowing about this technology. So I learned, you know, the old ways of doing things. This is how you research something. This is how you check your sources. This is how you do that and this. And I think that now that this sort of question and answer tool is so readily available to everyone, I think that we're gonna have to have that sort of education piece on how to like think critically about it and make good choices, be really mindful, and like maintain integrity. I think that's gonna be needed even more now that it's so easy. And yeah.
Yeah, and I also wanted to say, like, for one of my projects, we had to find children's literature that like pertained to the project that we were working on, and so I asked ChatGPT to help me find these books, and it gave me books that didn't even exist. It kind of created a book, and I went to copy paste that book on like Safari, and that book didn't exist.
Mm-hmm.
And so I was like, if someone were to just copy paste that and put that into their project or presentation, when it would come to talking about that book, you wouldn't know what it is, and also you'd find out that that doesn't exist.
Yeah.
So it's like you really have to be mindful and careful of what you're adding, because sometimes it just throws things at you or says, you know, this book doesn't exist, but I can make a version of it for you. And then that's kind of where you get into that red zone where it's like, maybe it's not as clear, or maybe you weren't as clear on your end. So yeah, doing a lot of, I guess, reassessment and analyzing it and all.
So you can think about the solved world, right? Like the Nick Bostrom book, Deep Utopia, deals with that. What will that world be like when all the big problems are solved? What will there be left for us to do, and so on? So if you think about rituals that you have with your friends, getting together, doing specific things that you've done a lot, you enjoy, that would still exist, right? And yeah, so there are things like that will probably still be a kind of human bonding thing that are outside the confines of this solved world. But it does, you know, what does it do to, you know, religion, to Alcoholics Anonymous, whatever is like, you know, big in the lives of the people that you know. So that's presumably coming, and that's the good outcome. You know, we won't necessarily get there, but assuming that things go well, we will.
Yeah, like I think that ties into like the keyboard liberation piece that we talked about a little bit earlier, like that we're not going to become robots or machines, right? That I think it's really exciting how even with us using this at school, like by making my note-taking a lot more efficient, I'm able to actually have time to see my partner. I'm able to spend time with my friends at lunch and not be stressed out about how am I going to finish all of the lectures for this week. And I think when we use these things really judiciously and still prioritize all of those beautiful things that make us human and that allow us to connect with things outside of this intelligent world, I think that it can be really beautiful, but it has to be used that way. I think that some folks probably don't use it as don't tell themselves, okay, I did this, so now I will go do this. Or I'm sure some folks are probably questioning those sorts of things. Like I could see someone really struggling with like religion and getting in like an argument with ChatGPT about it, and I could see that being like a detrimental experience for some people.
But you can also imagine that ChatGPT would be able to make a new religion that is so much more successful than all the ones that currently exist, and you know can get lots more converts and things. So be careful what you wish for.
Yeah. And I think that it does, I'm not sure that it necessarily like recognizes what religious feeling, like what the experience of being religious is. I think that that's a very lived experience. But I think that it can tell you a lot about, you know, the specifics of a religion.
What the sacred is, what does sacred mean?
I think that it can probably help you explore a lot of those things on like a very cognitive level, and then being able to kind of go beyond that on your own once you understand that, I think that that would be kind of the spiritual experience of that.
So there's like this company in the UK called Huma that just recently acquired eConsult, which is like a platform to just remotely kind of monitor patients and all that type of stuff. And so because like we're now seeing like major companies like this trying to actively implement like AI into their practice, do you think that the students who you're seeing who are opting to not use AI and ChatGPT in their kind of note taking and developing those skills, do you think that they're actually putting themselves in a position where they might not be as good physicians in the future?
I mean, I don't want to put my colleagues down.
Of course, no.
I'll talk about maybe my experience on the contrary of like I said, I didn't really use these sorts of things before, and I see where we're headed, right? I see these things coming up. I see how this sort of technology is going to continue to be integrated into medical practice. And for me, I don't want to just ignore it. I want to learn how to critically engage with it. I want to not be afraid of it, because once you feel that fear, or like I imagine some of my classmates might feel like guilt or shame involved in like getting help that way. I think that those negative emotions don't lend well to learning how to collaborate well with it. And so I think that by learning how to be friends with my G-Boy and learning how to interact with it and ask it questions like, tell me the truth, fact check this, learning how to kind of do that groundwork and that covering my bases, I think that it will hopefully set me up to engage with those technologies in the future. But of course, I think folks who, don't call it a G-Boy and like have a little bit more skepticism, I can also see how they'll have a really valuable voice in advocating for like the cautious use, right?
Of course.
Especially with a technology like that. Like, there's a lot of privacy concerns around implementing any sort of AI that's gonna like listen to every conversation, and I can imagine that some patients would have rightful hesitations when it comes to knowing that this thing is going to be listening to the whole conversation and worrying whether it's going to be truthful, like recounting it accurately, whether it's going to be involved in like some sort of data breach. Like I could see people who are less buddy-buddy with AI being really useful voices in kind of doing the like due diligence in making sure we're not just like, yeah, bring it on in,
Right.
like let it listen to this patient's most horrific experience of their life. I'm sure it'll be fine.
Yeah.
So
That makes sense. That's really good insight. I never like actually thought about it like that, but that makes a lot more sense.
I think, yeah, I'm a big fan of like every issue has two sides, and both sides have some sort of value that they bring, and so, I'll be the one that's like, look at my G-Boy, this is so fun, like here's how you can do all these things, and then my colleagues who are a little bit more skeptical, they'll be the other side of the coin that also have that really valuable insight to hopefully help us have like a really balanced view of how we're going to implement these things.
That makes sense. Thank you.
Yeah. Any other question? I didn't really have any sort of structure for today. Like, I have more slides that we can go through, or we can keep chatting. What's the vibe? What time is it?
10:55.
4 minutes of 11.
4 minutes till 11?
Yeah.
Okay. What would you all like? I know you have to go out soon. Yeah, that's okay. I appreciate you listening. I hope you,
Yes, it was so insightful, so thank you.
yeah, try it out.
Yes.
Get a G-boy.
For sure.
Ask it your questions. Do you have any questions before you go?
I do. I know that something that I've sort of tried to use ChatGPT for before is kind of when you're kind of looking at a set of data, just kind of determining the right statistical method for kind of interpreting that data. Do you find that is ChatGPT maybe as skilled at like interpreting data and kind of analyzing data as it is at just delivering knowledge and information?
Mm-hmm. That isn't really something that I've used it for. I think that it would definitely be something that you need to be a little bit more actively engaged in, rather like oversight. I think that's the word. Like you want to oversee what it's doing and make sure that you understand what it's doing and why. I think that would be a chance for you to do a lot of interrogating. Like, I don't like stats either, so I totally see the temptation of like, here's this thing, tell me what it says. I think that I would take that output and then try to run those analyses myself to see if I get the same result, first of all. And then I would also try to get it to help me understand why it chose that test. So let's say that it ran an ANOVA. These are the only stats tests I know. But let's say it ran an ANOVA and then really it should have just ran multiple t-tests or something, right? I would get it to explain like, okay, you chose this test. What other tests are available for testing similar data? Tell me why you chose this one over those. Tell me what the strengths are. Like I would try to use it as if I don't know, like understanding what the options are and kind of trying to teach myself how to make the right judgment call on whether what it did was accurate. Because I think that it might be able to explain those things. Like it would be able to say, a t-test compares blah blah blah, and an ANOVA da da da, and it would be able to break that down in a nice table if you're so inclined. And then you could then look at that, look at what it did, and then kind of do that critical thinking of, do I think that it actually did the thing that it said? Can I ask it to break down the steps that it did so that I can put those numbers in Excel and run it myself and make sure that it's all done properly? Yeah, I think that's how I would approach it. I definitely wouldn't just be like, oh, P less than 0.5, amazing, put that in my report. Like, I would be very careful about just accepting what it said, but you could still use it to figure out if it did it properly. Does that make sense?
It does.
Yeah.
It does.
Ask it all the questions.
Yes.
Like, why? Anything else?
That's sort of all on my part.
Okay, yeah, you don't have to entertain me with more questions. Okay, wonderful. Anybody else, or would you like me to tell you more things?
Yeah, continue on.
Oh, we have a question behind you, actually.
You can
Oh,
go first, it's all good.
No, I
oh no, she just
okay.
she just said continue.
Oh,
So.
okay. I was just curious, like, so when you're talking about how some students have been using Toronto's GPT with you, like, do you see kind of that there's like just one way of kind of taking notes now, or like two ways, or does everybody kind of have their own approach in med school, or?
Yeah, I think that there's definitely a lot of diversity. I can't speak to how everyone is approaching it. It's a big beast to approach. Even like everyone has a different strategy for how they want to organize their notes. Like, do you put your notes, because we don't go by like, we don't just do a cardiology unit, so you can't just put all of your notes from that week together and it makes sense. Like, how do you organize these things? Where do you put them? But I think people are definitely making it their own and kind of tailoring it to how they learn best. For me, like, putting something in a table that I don't know what clicks in my brain when there's like two things and I can compare them directly. I still have a lot of friends who can't learn something unless they literally handwrite all of it. And so there they are, like going away at it, and it takes forever, but that's their method. And then maybe they'll use something like this just for like follow-up questions, or to kind of help them create schemes like this where it makes sense to them. But yeah, it's definitely very different for everybody. There are like the general sentiment is that people are using it for the transcripts just because it's so much information. But I think what people do with that after varies a lot too.
Cool.
Yeah.
That makes sense.
Yeah. And I actually use it like, so at the end of med school, you have to write like a big exam, and that they post all of the like learning objectives on their website. So I'll actually get ChatGPT to tell me which objective I should file my notes under. Like if I'm learning about hypernatremia, be like, which MCC objective should I put these notes under? And so I have like my notes organized by the objectives that I'm eventually going to get tested on, and I'm filing things away under those so that hopefully when I go back it will make sense to be like, oh yes, this thing that I haven't thought about. But yeah, everyone has their own journey. I think I'm one of the folks who has been a little bit more experimental in figuring out what kind of note-taking and which, everyone has an opinion about like which note-taking app you should use, and I've asked some people which one they use and why, and they're just like, I use this one because like they have no real reason, and that's fine if it works, right? But I think that my friends and I played around a little bit more, like, ooh, try this one out, I'll try this one out, you tell me what you like, this, and anyway, that's a tangent. Let's see what else I have for you. So Dr. Soles and I so this is more applications of AI. This is more of like a research application. So we were involved in this ethics in xenotransplantation conference, and which is like talking about how can we put a pig kidney into humans? Can it be done? Should it be done? Question mark, question mark. And someone in our working group talked about how they developed a artificial intelligence model to decide who the first patients should be for receiving these transplants. They created this model, and it included a lot more things than I'm not in this field of work, but it included a lot more things than I would have thought to include, including like proximity to a surgical center and, you know, kind of stratifying people on all of these different variables. I guess that's all I had to say about that. But yeah, this is just like another way that we're using AI for really cool things. So as I said, I'm, especially now, like that I'm back in an environment where there's kind of like Calgary's really cool. I don't know what the U of A curriculum looks like, but we have a lot of sessions that are just focused on like the social aspect of healthcare, talking a lot about like addiction, you know, the experience of Indigenous folks in healthcare. We had a really cool like presentation about like weight bias and like fat shame and everything, and when we see like a BMI on our questions, like we basically only use it for like really specific things, and for me that's exciting to see that we're kind of moving past these purely objective quantifiable things and moving more towards like, what is this patient's actual experience? What is their life like? Like how can we actually manage that patient in a way that's meaningful to them and will work for them? So yeah, when we think about human flourishing, this is like the Harvard Institute who focuses a lot on human flourishing. They break it down in these 6 domains. And my reason for putting this up here is to say that like human health and happiness is really a subjective thing. It's really about allowing a patient to live their best life and working with them more as like a guide and someone that they can trust to kind of help navigate and give them good advice. But it's a lot less of this like hierarchical thing of like, this is what the research says, therefore you have to do this. I think that there's a lot more room for, you know, they don't get to boss you around. They don't get to be like, I want Ozempic because my friends are all on it. But you can take their input and kind of capture more of this like qualitative lived experience type stuff. So here's some like AI things that are a little bit more on that like soft skills side, which I find to be really interesting. So this is Woolbot. If you're in like, if you've ever taken a psychology class, I hope that you've heard of cognitive behavioral therapy. And Woolbot is like a chat bot that you can talk to, and it'll respond to you in a way that is like backed by like cognitive behavioral therapy. Yeah, I'll disclose, like, I have asked ChatGPT like some personal questions, and it actually has been not necessarily like, oh, I'm so sad, I'm so scared, but like I get really paranoid about being sick. And so I had a bit of a sore throat when I woke up a couple weeks ago, and I was like, what do I do if I have a sore throat? Because I was just like in bed like freaking out. I don't want to miss class, but they're very serious and strict about like not missing class. And so I was like, why would I wake up with a sore throat? Could I be sick? And it's like, here are all the reasons that you could be sick. And one of them was like that the air is really dry. And so I went down this whole like, okay, what has the humidity been like in Calgary lately? And it told me that the humidity had recently dropped in Calgary. And I was like, wonderful, because I had no other symptoms, but I was just like, you know, the anxious bean that I am was like, I can't get the entire class sick with my little sore throat that I woke up with. So I do think that it can help with this sort of like anxiety management or dealing with these things that are maybe you would think that it isn't capable of. It's not necessarily gonna tell you that it's proud of you, or, you know, like it's not gonna get to that point, but these sorts of tools I think can be really cool. This one is a website for teenagers called Character Lab. It's meant to help teenagers develop these sorts of like soft skills, if you will. I think that they're modules. It's been a while since I looked into this one, but I think they're like different modules, and then the teen will get like feedback on how they're doing. And so I find this a really interesting way that it can kind of tap into this like thing beyond just numbers and data points. Of course, our algorithms are watching us whether we want them to or not. And it's really exciting how it, most of the time, is for good. You know, you really like a cat video, it's gonna keep showing you cat videos. If you have, like, I find a whole bunch of new accounts all the time of like I'm interested in going into psychiatry, and it'll like, somehow it knows that I want to do psychiatry. I'm sure it's been listening, and it'll like recommend me like really cool psychiatrists to follow, and it's been nice to kind of expand myself socially in that way, so that I'm like, oh look, there's a person who is living a normal life and they seem happy doing the thing that I want to do. And of course you can make friends and connect with a bunch of other people. Okay, now the bad stuff. So I think we kind of talked about this, how AI and privacy will always be a really huge debate, especially when it comes to sensitive information with patients. I think that, you know, when we sign up to do medical school, we have to agree to maintain confidentiality. When we like go volunteer at a homeless shelter, they make us sign a confidentiality agreement that we will uphold. But of course, AI isn't capable of that, and there can be data breaches that are just, I don't know how these things work exactly, but you know, it can happen spontaneously, or it can be kind of more of like a malicious thing. And I think that implementing these sorts of tools, not only kind of from like the back end of like, how do we make sure that this is safe, how do we make sure that the confidentiality is maintained, but then how do we communicate that to patients and anyone who might be engaging with this technology with us? Like, how do we make sure that that patient feels safe and secure, that they're able to open up to me and now my G-boy too? Like, I think that that is going to continue to be a challenge, and I could see some people who just won't care. Like, there are patients who, like, when you get them in the room, they literally are just undressing and they're like, here, like, this is me, I don't care what happens here, like, this is it. And I can see them maybe being the same kind of like cavalier way, like, what is AI gonna find out about me that I won't tell anybody anyway? That's more the vein that I'm in as a person. But I think that there are definitely, rightfully, people who are a lot more skeptical and who are just naturally more private people who would be a lot more apprehensive about the risks that come with these things. And I think no matter what, like, offering patients the opportunity, like, you know, informing them that this is a thing that we're going to use now, and then giving them alternatives if they want, right? There might be some, like, trade-offs. Maybe if they come to the appointment and they consent to having the AI like take the notes, then maybe we can talk about more problems that day in our 15-minute appointment. But if a patient comes in and they're really uncomfortable with how this technology could be used, then I gotta go back to basics and I'm typing 1,000,000 miles a minute, but I might not be able to get to all of their concerns that day, right? But I think either way, we're gonna have to have options and not just force people to engage with these technologies, even if they're uncomfortable. Yeah, a lot of our research, not just AI research, but research in general, is what they call weird. So I don't know, have you been involved in like a research study? Like in psych, they make you do research as like part of Psych 104 requirements. Do they still do that?
I think so.
Yeah, I had to
Yeah.
2 years ago, so
They made me cut my fingernails when I went. They like cut my fingernails and took my fingernail clippings. I don't know what it was for. I mean, I did at the time. I did consent and it was fine, but like, it was to measure something in my fingernail clippings. So that is permanently etched in my mind. But yeah, often when we want to get research, we ask who's available. Undergrad students, people who live close to a university, and that obviously biases our data towards people who live in Western, educated, industrialized, rich, and democratic societies. So we need to be very careful of how we're generalizing these findings in like a global context and a local context, right? Like Canada is so diverse, it's hard to say this kid who goes to university, they represent the entire experience in Canada and the world, right? So I think it's just something to be cautious of, something to continue improving, continue doing better jobs at involving folks who are diverse in any sort of ways, but not like tokenizing them, because that's also problematic. If you're like, you are the one black person that we're going to talk to in this study, tell us what black people are like that's not cool. There was a bit of a controversy in one of the topics that came up for us with whether a certain medication, like the guidelines, I don't know if they're current guidelines or like the previous guidelines that the curriculum had been based on, but it said X drug couldn't be used in black patients. And we all said, why? What, like there's no, it was like, I think it was ACEs, like just like a hypertension medication. And when you look into it, like what mechanism could there be that would make it not usable? And I think when we looked into the guidelines and why that was a recommendation from whatever point in time, it was just that they didn't study enough people, and the people that they studied had like a slightly significant finding that then made it into the guidelines. So when we got tested, they took those questions out because we all agreed like that's not what we're about, and that's probably not an actual meaningful finding. But it really makes you wonder like how many other subtle little things are integrated into healthcare that don't actually serve people broadly. Yeah, so this kind of gets to this. This lady found that this like facial detection software couldn't recognize her face because the algorithm that was used to train the thing wasn't able to identify, it wasn't trained on like a broad variety of faces. It couldn't detect folks of different colors, of different facial structures, and yeah, like it's really concerning if we're thinking about how these sorts of things could be implemented on really broad scales. We don't want these sorts of old ways of thinking to somehow be integrated into the things that are supposed to be moving us forward, right? Yeah, so this is a really cool book on the topic, how data increases in quality. This is not, I think the title is actually Weapons of Math Destruction, Math, M-A-T-H, but yeah, I definitely recommend checking this book out. Yeah, so this is a quote from that book where they talk about how creating a model involves simplifying the world into a toy version that can be easily understood and from which we can infer important facts and actions. So models are great. Models are so useful in their ways, whenever I think of a model, I always think of like the atom, right? If you think about how, I don't remember them all, but like we had the pudding model and then we moved this, and like there's an element of truth and like utility in each of those iterations. But then now that we understand how it really works, and my little brain wouldn't even be able to comprehend what an actual atom looks like and all the moving parts and electron intervals and, you know, all of that, I think that it doesn't mean the other ones are bad or don't have utility, because you can understand chemistry in starting at those places. But when we actually want higher order, wide scale implementation of these sorts of things, we need the really complicated quantum physics-y things that I can't even process, right? When we're thinking about using these on these big scales. Yeah, it remains to be seen whether AI is capable of like emotional intelligence. I think it's really interesting to think about how AI could maybe understand like social norms, you know, and whether it would actually be able to execute those. Like, would AI know not to say something that might hurt your feelings, or is it just gonna say the thing anyway? Yeah, I think that emotional intelligence is definitely one of those things that makes humans really unique, and our ability to be like introspective and reflective is a unique thing that we have that I'm not sure can just be ones and zeroed out, you know? Yeah, so this is just my speculation and my thought, but I suspect that it's probably capable of like cognitive empathy, where it's like that person might feel sad that they failed their exam. Knock on wood that I didn't fail my exam, but like, you know, that is sad, frowny face. But I'm not sure that AI would be capable of these like higher order levels of empathy, where it's actually able to like feel the thing that you're feeling. Like if you're sad, I can feel that you're sad. I can feel the emotion that you're feeling and act accordingly. I think that, you know, the lower end of things might be possible. Yeah, so standpoint epistemology kind of refers to that like lived experience thing about how people from different people have their different experiences, and that gives them certain perspectives, certain knowledge. And I'm not sure that AI would ever be able to like integrate all of that. My very like curious mind is interested in the idea of like, if we all upload our minds, like what would it make sense of those things? Like would it be able to understand that like I was afraid of lightning as a kid, and then find other people and make sense of that somehow? But I don't know that we're there yet, and I don't know what that would even mean or look like to be able to like quantify the very like lived experience, like we were talking about the religion. Like how do you put that into an artificial system? And yeah, I'm a big fan of intersectionality. So this refers to kind of how all of the isms, all of the bad isms kind of interlock and contribute to these really unique experiences. And I think AI can play a role in that. Like it can kind of say like, oh, maybe someone who's a woman of color has a certain experience. But again, I'm not sure that it's capable of like feeling that experience or comforting that person in a way that their experience like is meaningfully understood. Yeah, AI tells us what we tell it to do. It learns ethics based on what we say and what it observes. I think when I gave this presentation back in March, we talked about the Twitter bot, and people decided to like slander it and teach it to say really nasty things. And then it did, and that's scary. Like, I think that there is room for oversight, and again, I don't know how someone develops AI, but there's probably ways to like manually input it, but then if we're manually inputting it, it's just reflecting the values of whomever's doing that, and that's a lot of authority to give one group or one person. And then if it's somehow like crowdsourcing morality, then we run into people who have very different opinions and who, you know, they might not be able to tell how to contextualize things to certain circumstances. Yeah, I think there's definitely, I have asked it some questions about like cultural competence and like asking how might this be challenging for an Indigenous person, or like what challenges could you expect for someone who lives in a multi-generational home, and it's able to give me very like, well, this might be harder because they might not have access to their own vehicle or whatever, right? Like very rudimentary, that cognitive empathy sort of thing. But I'm not sure that it's able to really tease out all of these underlying things, especially like, yeah, with how diverse and how like culture's a very group thing, but it's also a very individual thing, and I'm not sure that it could understand how to do those things. The whole point of my presentation is to suggest to you that collaborative intelligence is the way forward. I think we've talked a lot about how I'm using AI now, and it's a very like purposeful thing. It's very collaborative. We're working together. I don't think that I want a world where I just have an AI assistant and I keeps getting ads for like, let an AI assistant plan your schedule. No, like I'm not sure what that process looks like, but I know that I'm a night owl. If AI is telling me to study at 8 a.m., like that's not gonna work, right? So I don't think that we should be hoping for a future where AI just liberates us from all of these things, because I don't really want it to or trust it to. But I do think that we can kind of use it in a way that complements us and helps us improve upon ourselves in like a very intentional way, rather than just like a, well, you do this now and we'll figure that out. So yeah, I hope that you're able to continue thinking about how you can integrate it into your lives, and more importantly, how you can kind of keep it accountable and use it smartly, critically, mindfully, demurely. Is that a thing the kids still say? I feel so old in all my classes. Like, I'm 27, and there's people in my class who are like 21, and they speak a different language than me. And I come to accept that. But yeah, this is just how AI and human intelligence are different. So do you have any more thoughts or any more questions that have come up? We can maybe talk about any of these things, whatever suits y'all.
Just to clarify, so are you a first year student at Calgary?
Yes, I started in July. Yes, it has been fun. It actually has been. Yeah, if you have any other questions about just school too, I can try to tell you about what that's like, but yeah, it's been.
Well, thank you so much.
Yeah,
No.
thank you for coming. big jaunt to Edmonton. It feels weird to be back here. Like, I have finally started identifying with being a Calgarian, and now I come back here and it feels like home, but foreign. I don't know.
Well, we've never had an experience like this in the class, and yet a large number of the students are interested in careers in medicine, so you obviously provided content today that many people are looking for. So, yeah, thank you
Thank you.
very, very much.
Thank you
Yeah,
for coming.
yeah, it was great.